So, good morning, good afternoon, or maybe we cannot say good night, but obviously wishes to whichever time zone or day of the day, sorry, time of the day, which you are tuning in to watch this video. Basically, today we are gonna be looking at how we use techniques of behavior modification to address certain psychological and behavioral issues. We're going to start with how we use the techniques of behavior modification to address anxiety issues, right? So basically, fear is composed of both operant and respondent behavior. Typically, a person is afraid of a particular stimulus or a stimulus situation, but fear doesn't necessarily always translate to anxiety. When a stimulus is present and the person experiences something called a fear or something which is quite similar to fear, the body uh, undergoes certain physiological changes which leads to the person experiencing unpleasant feelings or emotions. And all of this is usually due to autonomic nervous system arousal. And then this, this usually leads to your stress response kicking in along with your survival mechanisms all uh, owning themselves, leading to your flight or fight response, which you know increases your blood pressure. It starts to increase your heartbeat, and it puts your body in a state of being ready to respond to a particular threat that your body has perceived. Your muscle tones become, you know, tighter. There's adrenaline pumping through your body. You are basically ready to face a life-threatening danger. And fear also elicits a particularly similar kind of response. And this then your body gets ready for an escape or an avoidance behavior. Now, these particular responses, when they are accompanied with certain emotional content, we usually term it as anxiety. When the fear responses goes overboard, it usually results in the person feeling something called anxiety. The autonomic nervous system arousal involved in anxiety is establishing operation that makes it more likely that the person will engage in escape or avoidance behavior at that time, also in future occurrences. So, in this particular case, the stress or anxiety response which occurs with or before even the actual occurrence of the threat itself acts like a motivating operator in that particular scenario, right? Which um, influences for future occurrences of anxiety related escape or avoidance behaviors. Now, how do you uh, counteract these symptoms or the physiological responses associated with anxiety issues? Let's say your particular friend or you yourself have an intense fear of dogs. Whenever you see a dog, you start to panic, you feel anxiety pouring through your veins, fear pouring through your veins, and you become all tensed up. This also occurs when you even try and imagine facing a dog or looking at a particular dog. Now, what do you do in these scenarios? How do you approach this issue? And since this issue has classical conditioning built into it, along with some bit of operant conditioning too, if this is particularly a stress response or an anxiety response that has been happening throughout the years, obviously there's a habit component built into it, and there are some operant factors that are either that are reinforcing that particular behavior. How do you approach this? Behavioral techniques, along with some cognitive behavioral techniques, seem to be the most effective way in managing anxiety related issues, especially counteracting specific phobias and other issues, even such as social anxiety disorder. We look at certain specific techniques that can be used here. The first being relaxation training. What happens when you undergo a stress response or a fear or an anxiety response? As we discussed before, one of the most primary symptoms of a particular response, that particular response is your muscles getting tensed up. Every time you undergo chronic stress or chronic levels of anxiety and fear, your muscles in particular regions of your body, which is very unique to each individuals, they get tensed up and they stay that way. This is due to the survival mechanism, as we discussed before. But when they are repeatedly being exposed to stimuli that elicit the same stress or anxiety response, the same stiffness continues, it persists, and it becomes a chronic issue. Now, relaxation training helps us to ease these physiological symptoms, ease the muscle tone, ease our breathing, ease the panic levels, and pushes us into a calm, a more emotionally neutral state. Now, relaxation training procedures are strategies that people use to decrease the autonomic arousal they experience as a component of fear and anxiety problems. The person engages in specific relaxation behaviors that result in bodily responses opposite to autonomic arousal. As we said before, when you are aroused, your muscles become rigid, they become tight. So, in relaxation training, we teach people to loosen their muscles, to loosen their body, and then to calm their breathing, to slow down their breathing, to make sure that their breaths are more deep, not shallow. One of the most common symptoms that you'll see of a panic disorder or a person becoming very anxious is their breaths become very shallow. They don't take deep breaths. The breathing frequency increases a lot. All this is due to the internal autonomic arousal. We teach them to do the exact opposite of all this. In turn, physiologically and psychologically tricking their body into thinking that okay, it's in a relaxed state, when the physiology is indicative of a relaxed state, the mind believes that okay, I am relaxed, and thus the person actually becomes relaxed. This is the basic mechanism. Some of the uh, subsets or specific techniques that we usually use in relaxation training include progressive muscle relaxation, wherein the person is usually instructed to lie down or sit in a comfortable position, and then we, as therapists, we give instructions to the clients wherein we ask them to tighten a specific set of muscles, a group of muscles, for some seconds, and then they are instructed to release the muscles, loosen them up, and pay attention to how easy or loose that particular muscle group feels. All this while they are having slow breaths. One of the most prevalent or famous versions of progressive muscle relaxation is JPMR, which was given by Edmund Jacobson, and now it is one of the most widely used techniques to counteract a lot of stress related issues, sleeping issues, as well as anxiety problems. As we see in this image, we usually either start from the forehead, and then we move along the body, engaging specific group of muscles, one group of muscles at a time, and we progress until their foot. Or we can also do it in reverse. We can start from their foot and progress upwards towards their forehead, with finishing on their forehead. This is one of the ways. Next is diaphragmatic breathing. uh, sorry, diaphragmatic breathing. This is what I explained before, wherein you ask them not to take shallow breaths. You ask them to take very deep and, you know, slightly longer lasting breaths. Panic attacks and anxiety related bodily responses are characterized by very fast, rapid, and shallow breathing. The breath is so shallow that the air doesn't exactly reach the lungs in its fullest capacity. It just goes, and before the air gets processed, the breath is left out. And this causes a lot of issues. And it is not an ideal way of breathing. So you ask them to take deep breaths, and each time they inhale, the person uses the muscles of their diaphragm to pull the oxygen deep into the lungs and then slowly release their breath. This diaphragmatic breathing replaces their uh, panic-driven shallow breathing with more rhythmic, slow pattern of breathing, which eventually makes them relaxed. Next, you have attention focusing exercises. Now, when a person is feeling anxious or when they are undergoing an anxious response, their attention is very scattered, or their attention is totally filled with images and sensory information about the particular stimuli that they are anxious about. Let's take the same example of you being afraid of a dog. When you look at a dog and you are feeling the anxiety drive through your body, no matter what you do, the only thing that you're going to think of is the dog. You'll think whether it's going to bite me, or whether it is going to come near me, it is going to threaten me, or if you have other fear related thoughts that you have associated with dogs, like you have had previous incidences where a dog has chased you or given you a bite, you look for the same symptoms in the dog, whether it is similar looking to the same dog who chased you. All this is going to be happening in your brain. Now, what we are going to do in this particular case is we are going to pull the attention from the fear related stimuli, and we are going to redirect their attention towards another relaxing or neutral stimuli. So these exercises, they produce relaxation by directing, or we can say redirecting, the attention to a neutral or pleasant stimulus to remove the person's attention from anxiety producing stimulus. These procedures, one of the most famous ways through which this is done is either through concentration meditation. Mindfulness meditation does not work here because when a person is insanely anxious or going through panic, if you ask them to be mindful about the panic or the anxiety response, it doesn't work because they being aware of it. See, mindfulness does work in this case only if they have been a regular practitioner or of mindfulness. Because once you are aware of the anxiety, once you are aware of what exactly causes it, once you are able to, once you have achieved a such expertise that you are able to view the anxiety at a distance, and you're just viewing it without any judgment. You are viewing it from a very neutral perspective. The anxiety will go away. But most of us are not, you know, very pro mindfulness practitioners. So mindfulness is not really recommended here. Concentration meditation helps. Concentration meditation involves, asking people to focus on a particular uh, visual or auditory stimuli and keep repeatedly redirecting their attention towards the same stimuli. One of the most easily accessible examples that you can give is usually when we see meditation in popular media, it is always involves someone who's chanting a particular mantra or a name, or one who is always looking at a glowing uh, a lamp, or a candle, focusing on the flame and you know meditating. That sort of meditation does work, but a more engaging sensory experience and a more relaxing one is guided imagery, wherein you again, just as we did with progressive muscle relaxation, you ask the person to sit, you ask the person to sit in a very comfortable manner, and since it is going to be you know instruction based, you need their attention. So you ask them to close their eyes, and then you either, as a practitioner, you give a pleasant image to them and try and let them recreate that in their mind, or you leave the image to the client. You ask them to imagine a particularly pleasant stimulus, an image, a place, person, anything, and then you engage all five senses. If it is a place that you are asking them to imagine, let's say they're imagining sitting on a beach, then you ask them to feel how the temperature of the beach is. You ask them to see the what day of time it is, how it looks, what colors they are able to visualize. You ask them to hear the sounds of the beach, what they are able to hear. You also engage their senses of gustation, and you ask them to see whether they can smell the smells of the beach. And if possible, you can also ask them to see whether they are able to taste anything, if the particular guided imagery involves a food or a tasting component. That can also be done. So basically, we engage them in all five senses and let them create this whole peaceful image in mind. This takes some time. Usually, it takes anywhere between 15 to 30 minutes minimum for the client to do that. And through this process, they will become very much relaxed. But this process usually shouldn't be rushed. The clients sometimes need their own time doing it. Yeah, but when it comes to managing phobia, we have a superb technique, perhaps the most widely used one. Right now, we don't use it exclusively as a behavioral technique. We usually integrate some sort of cognitive elements too. This particular technique is called systematic desensitization. You take the two words, you split it up, you get the basic technique. Desensitization is a process where you are repeatedly being exposed to a particular stimulus, so much so that the wow factor of or the experience of the stimuli gets very well known to you or becomes almost a part of the routine. There is no more a surprise value. You basically uh, become very desensitized to that particular stimulus. Let's say you really like ice cream, you really love to eat it, but what if I give you ice cream every day? Imagine if I give you ice cream for every meal of every 3 meals a day, every day, and if we let's push it to an extreme and say I say you have to eat ice cream for only ice cream as food, no other food, you eventually lose the good connection that you have with ice cream, the pleasantness, the taste that is associated with it. You basically become desensitized. This can be also true for very adverse stuff and unpleasant things too. What we basically do is we use this principle to counteract phobia with relaxation. Obviously, emotions can be seen as a spectrum consisting of two different extremes. That is what the yeah, there's a particular group of theories. I cannot really recall the name for now, so pardon me. So basically, that line of perspective says emotion can be seen as two different extremes, right? You can either be happy or you can be depressed. You cannot be both at the same time. And once you become desensitized to happiness, you eventually will be pushed towards the other extreme, which is depression. We are going to use the same principle. What we are going to do here is you ask the client to, first, you usually teach them relaxation. You can use either of the techniques that we discussed before, which is most suitable to your client, which they most like, and which is the most effective one. We teach them deep relaxation exercises. Then you create a fear hierarchy. Basically, you ask them to think about their particular phobia stimulus or anxiety provoking stimulus, and you ask them to list down 10 uh, different stimuli related to it. We are going to create a fear hierarchy. You are going to ask them to first list down a related stimuli that causes them least anxiety. Then the 10th one is going to be what causes them the most anxiety, and then they have to fill in between. Through this, you create a fear hierarchy. Basically, for example, if we take the old dog example, let's say your client has least anxiety while they're looking at a photo of a dog. Then while they're imagining a dog, it becomes more anxious, and when they actually see a dog, they are more anxious, and when a dog actually comes and touches them, it is where they feel the most anxious. This is how the fear hierarchy will be. Now what we are going to basically do is we are going to make the clients practice the relaxation technique that we taught them, and then they are going to enter a particular state of mind where they are relaxed. Then we are going to expose them to a stimulus, and if they are sufficiently relaxed, they will be able to experience that stimuli without getting anxious. After repeated exposures, guaranteeing that they absolutely feel zero anxiety in that stimulus, we are going to move to the next one, basically doing the same. By this step-by-step procedure, we are going to eventually expose them to their most anxious or most fear-inducing stimuli too, and we are going to counteract the symptoms of phobia. This particular working through can be done in two ways, either in vitro, wherein the patient imagines being exposed to the objects, or in vivo, wherein actually they are exposed. Yeah, basically, we had an earlier version of this, which was known as flooding, where I wouldn't even call it an earlier version. That was, basically, you're fearful of dogs. What we do is we take you and we, without informing you, we push you into a room and we close the doors. And once you are inside, you will see that the room contains multiple dogs or one particular dog, and you can't get out until you have, conquered your fears or stuff like that, or after or until a particular amount of time. This is right now considered to be highly unethical, and it is not used anywhere because if you do that, some people might argue that you know people will get over their fears when they absolutely need to. Maybe that is the case, and that might work in certain situations if their fear is mild or at a surface level. But if that fear or anxiety is somewhere interlinked with psychological phenomena, psychological trauma, then it wouldn't work. What it basically does is it pushes the person more. They become more anxious, they become more prone to panic attacks, and they may even pass out. So this particular technique now is not followed anywhere. It is considered highly unethical. most of in most cases, systematic desensitization works brilliantly well in countering the effects of specific phobia. Yeah, so I just wanted to see if the recording was okay. So today we took a look at certain techniques that counteracts anxiety and phobia related issues. In the next classes, mostly we'll also focus on other self development issues and other psychological phenomena and how we can apply behavior modification techniques to effectively counteract them. So, thank you, and hopefully, we'll meet on a better day.